Good morning, my name is H3 Griswold. Today I'm going to be going over the PAPR and how it works, the functionality of it, the pre-checks, and the donning and doffing procedures that follow with it. We have our fan, our filter, our battery, our belt, our holding device, our hose, our hood, and our testing tube. The first step is going to be your pre-checks on all of your equipment that you have. So you want to make sure that your hood has no rips or tears in it. The most prominent spot is going to be at the hose connecting piece where you're going to be putting the most force on the hood, where you would see those tears and that breakdown. Next, we want to look at our hose. We want to make sure that there's no rips or tears in it as well, or any corrosion or breakdown. We're going to take a look at our battery, make sure that there's no dents in it and that it's fully charged. Our filter, make sure it's completely white and that there's no breakdown or corrosion or color change on that filter. If there is, switch it out for a different filter. These filters are good for 6 months after the date of opening them. So once you opening them, you have a date and time that you open it at from 6 months on. Other than that, these are good for about 10 years. Your fan, again, make sure there's no breakdown, dents, corrosion on the seal here to make sure that that hose connects perfectly fine. And lastly, you'll have your belt. You just want to make sure, again, that there's no breakdown and that these clips are going to connect to itself properly and that they aren't going to hang up on each other. So for the setup process, you'll grab your belt first with your holding device and you'll insert it into the belt with the flat piece going to be against your back. So it'll look just like this. We'll connect our fan to the back of the belt with these 3 notches, ensuring that the hose piece is going to be sticking up. And it'll look just like this. Next, we'll take our filter. We want to make sure that bullard is read fully across when it's connected onto the back of your back. So we'll insert the filter at about 11 o'clock. And the easiest way to do it is put your forearms flat and twist until it connects onto this notch right here, a part of the fan itself. Next, we'll take our hose and we'll connect it to the fan itself. We'll thread it on. There's only one side that it threads onto. Once it's connected, you'll then test and make sure that your fan is working properly. So we'll take our battery and we'll ensure that the metal piece connects to the metal piece here and it clicks in place. Just like that. We'll then use the power button, which is located on the fan right here, this big silver button. We'll hold it down for about 2 seconds, and it'll turn on. Once it turns on, we'll take our testing tube, we'll insert it into the top of our hose, and we'll make a fist with our hand, and ensure that this ball within the tube itself is above these 2 black lines. If that's the case, then you have a solid fan and a good working battery. We'll then turn it off and connect our hood. When connecting your hood, you want to make sure that you're putting on the hose aggressively enough to where it's going to secure in place, but not too aggressive to where you're going to tear your hood. So like so, you'll take your hose and your hood, you'll connect it in place to where the notch is above, and you'll twist it in, and it should look exactly like that. Now, in order to put on your PAPR, you can do it by yourself or you can have some assistance. I find it easier to just, if you're doing it by yourself, throw the hood over your shoulder, reach around and lean forward, and clip it in place. Once it's clipped in place, you'll then put a surgical mask on. Now, the reason for that being is when you have these PAPRs on, you need to make sure that you have a mask on because these holes down here at the bottom, they can release your secretion. So if you're talking to a patient or another person, you have the potential of spitting on them, essentially. For the purpose of the video, I won't be putting on a surgical mask so you can hear me a little bit easier. Now, we'll put our hood on, and we'll secure it in place, and we'll make sure that this blue strap is underneath our chin and that our ears are outside of the hood. The reason being is so that I can hear you, and I also use a stethoscope at the same time if need be. I can reach back here to this power button. Once it turns on, that's how you know you have that proper positive pressure pushing in behind you. So even if your seal were to break,
it pushes that positive air out and you would not be breathing it in. Now to switch from your high to low setting, you have that button back here. You'll hold it down for about 2 seconds till it beeps, and you're now in that low setting. There's not much difference between the high and the low setting other than the fact that it saves your battery life. Now going back to your battery is good for about 10 hours in the low setting and about 4 hours on that high setting. So before your battery eventually dies, it'll give you a tone. It'll be a 2-beep tone to let you know that you have about 15 minutes of life left within your battery. Now, if your filter in the back gets blocked, more than likely by your gown, you'll have an asystole tone. It'll be a beep. That's letting you know that your fan is blocked, and you can just reach back there or have somebody assist you and pull away whatever's blocking your filter out of the way, so that way you have your fan working properly again. Now, in order to doff your PAPR, you'll just simply reach back behind you and turn it off. And it takes about 4 to 5 seconds for it to actually turn off. So once you turn it off, you'll take some cavi wipes. You'll cavi wipe the outside of your hood. You'll then remove your mask and cavi wipe the rest of your PAPR system itself, the hose, the belt, and the fan, but you will not cavi wipe that filter. If that filter gets compromised, you're going to have to buy a new one or get a new one from the packaging itself. Now, with these PAPR hoods, they're only good for one person and one person only. Hence why, once you get it, you'll put your name across the top in Sharpie or black marker. That way, no one else can take your hood, because essentially they are not going to be cavi wiped on the inside. And if you cavi wipe them on the inside, it'll cause more breakdown and corrosion on this rubber seal. That's why they're only good for that one person. If you have any more questions in regards to the PAPRs, how they work, or how to set them up, you can find me in the ICU or email me at kevin.m.griswold.mill@mail.mil. Thank you.